Well, there are 3.5 million cases of the coronavirus around the world and 251,000 cases here in the U.S.
1.1 million cases in the country and now 68,000 deaths. And tonight, experts are saying that twice as many Americans could die before this is all said and done.
And the FDA is looking into issues with its antibody test. Joining us tonight with more on these and more is the Black News Channel's Chief Medical Director, Dr. Corey Hebert. Hi, Dr. Hebert, how are you?
I'm great. How are you guys doing tonight?
Good, good. So we want to start talking about the antibody test. What's happening with that? What's going on?
Okay, so this can tend to be a little bit confusing, so just follow me, okay? So basically what happens is you have a test that you would take the swab, put it in your nose, and then that would be the test to see if you actually had the virus, okay? And then you had a test, and that's the blood test that people are getting, and that's the antibody test. And what that test actually shows is if you have antibodies to COVID-19 that will protect you for the long haul, okay? And will protect you over time. Now, the double whammy on this is about a week ago, the World Health Organization came out to say that we're not sure if these antibodies are going to protect you anyway. That's the first whammy. The second whammy today is that the FDA has come out to say that they allowed so many of these manufacturers to come out to make this particular test, and they didn't really verify whether the tests were accurate. So now, if you're sitting at home with an IgG antibody or an IgM antibody test that you took by your blood, and it said that you were positive, you thought that you at some point were protected. But the tests are really not real. They're like bogus. So the FDA came out today to say, look, these companies have 10 days to produce the data to show that their test is accurate, and if not, they're going to put them off the market. But the problem is, there's no way for you to know if that test that you had was one of the ones they're going to pull off the market. So it's one of the worst things, because that IgG, if you have that test, what you were thinking is that I can go back to work. I'm protected. I'm safe. And what we know is that we really just can't say that at this point. And that's a horrifying thing that has happened.
I have a question for you about remdesivir, doctor. We heard earlier tonight that when it does become available and when people do use it, it could be effective, but it's going to cost maybe $4,500 for one dose. How many doses would it take for a person to actually become well if everything goes perfectly well?
Okay, so the first thing is, with remdesivir, it's an IV drug. It can only be used in the hospital. It can only be given to people that have a decrease in oxygen requiring, meaning intubation or oxygen by nose, okay? So if you are at that point, they're gonna bill you. You're not gonna have to just go to the drugstore and pay for this, because you can't even get it in that way. So, but the point is that you're going to need, sometimes they give a 5-day course, but this is still an investigational drug. They gave an emergency use approval because it looks like it has some promise. So, but the $4,500 is an infusion. It's not like a pill or anything that you would take. So the last thing that you should be worried about if you're in that situation is how much it's going to cost. But the point is that the president and some of the other powers that be have said that they were going to pay for the test. And some said they're going to actually pay for the therapy. But if you get remdesivir, you're usually on a study, and they're studying this drug, so you probably won't have to pay for it at this point if you get it. It's just in the pipeline now of the medicines that are going to be given emergency use so that we can get through the testing.
So, Dr. Hebert, we're seeing a number of states that are reopening in partial phases. We saw, though, in Atlanta, a bunch of people gathered together to buy sneakers. I mean, what do you want to tell people who are hearing that, stores are reopening or whatever, and are just going out there like business as usual?
We got about 20 seconds.
What I want to tell you real quick is that the University of Washington increased the numbers today from deaths by June 1st from 70-some thousand to 134,000. If you want to be one of those 134,000, just go buy some Jordans and see what happens. 20 seconds.
All right. Thank you so much for joining us, as always, Dr. Hebert.
Thank you.